So someone wanted to know how a carotid cavernous fistula, a CCF, can cause ophthalmoplegia. And ophthalmoplegia just means the eyes aren't moving properly. And so the carotid cavernous fistula is an abnormal connection between the artery and the vein without an intervening capillary bed. The artery is the carotid artery or its branches. So either the internal carotid artery, the external carotid artery, its branches, or both. And the vein is the cavernous sinus. So because the cavernous sinus already contains cranial nerves 3, 4, and 6, some patients with ophthalmoplegia from carotid cavernous fistula actually have neurogenic cause because the jet of blood from the high flow carotid is hitting the nerve or producing ischemia to these nerves. This is a neurogenic etiology for ophthalmoplegia and CC fistula. However, there's this alternative mechanism for ophthalmoplegia, which is not neurogenic, it's the muscles. So here are the muscles of the eye, in this case superior rectus and inferior rectus is the cornea. The blood has to drain out from the orbit, and the major draining vein of the orbit is the superior ophthalmic vein. There's also an inferior ophthalmic vein, but the superior is the main draining vein that drains directly into the cavernous sinus. And so if you have arterial blood from the carotid, either the internal, external, or both, going into the cavernous sinus, that arterialized blood will go retrograde back into the orbit and cause enlargement of the superior ophthalmic vein. That will cause the blood to back up into the orbit and to the extraocular muscles and will produce proptosis, chemosis, injection, a red eye, arterialized flow in the conjunctiva and the episcleral vessels that will look like corkscrew and dilated vessels. But because the muscles are edematous, because they have venous blood that cannot drain out, that is a muscle version of the ophthalmoplegia. So the answer to the question, what is the cause of ophthalmoplegia in carotid cavernous fistula? Well, it could be neurogenic from cavernous sinus involvement or myogenic from retrograde venous outflow obstruction going the wrong direction and causing the muscles to be enlarged and poorly functioning.